Bismillahirrahmanirrahim. My affectionate students, today I am going to discuss about biotransformation. Biotransformation is a molecular alteration of drug, is a process of molecular alteration of drug in the biological system. The drug enters into the body by virtue of its lipid solubility. Drug retains inside the body by virtue of its lipid solubility. When drug enters into the body, it will not be extracted from the body unless there is a change in its molecular structure. That means it loses lipid solubility, becomes water soluble, ionized and polar, then it will be extracted from the body. Had there been no biotransformation inside the body, what would be the fate of lipid soluble drug? Lipid soluble drug will remain inside the body for indefinite period and will do harm to the body. That's why Almighty Allah given the power to the body that it will convert lipid soluble drug to lipid soluble unionized non-polar drug to water soluble ionized polar form, so that it will be automatically excreted from the body. So the primary objective of drugs is to excrete drug, is to make drug in excretable form so that it will be excreted from the body. This biotransformation occurs inside the body and without help of enzymes, mostly with the help of enzymes. Now, the objective of biotransformation is to make the drug, convert drug into excretable form so that it can be excreted, eliminated from the body. Now, results of biotransformation. There are several results. I am going to discuss one by one. Number one is, by virtue of biotransformation, most of the active drug becomes inactive. Most of the cases it occurs. Active drug, parent drug active, and the metabolite is inactive. Example, noradrenaline, adrenaline converted to VMA, that is vinyl mandelic acid. Acetylcholine converted to choline and acetic acid. Sulfonamide converted to acetyl sulfonamide. Then chloramphenicol converted to aryl amine or chloramphenicol glucuronide. Then morphine converted to morphine glucuronide. So these drugs, primary drugs, are active and it loses its activity, becomes inactive. This is the first result. Now the second result, the primary drug is inactive and it will be converted to active form. For example, levodopa converted to dopamine, alpha-methyl dopa converted to alpha-methyl noradrenaline, pyrazinamide converted to pyrazinoic acid, then tal-ampicillin or becampicillin converted to ampicillin, cyclophosphamide converted to phosphoramide mustard. Now, the inactive drug, parent drug is inactive and the metabolite is active. So the parent form is also called prodrug. Prodrug means active drug hides inside this drug, and when it will be introduced into the body either by ingestion or by injection, due to biotransformation, the active form is converted as metabolite. So the primary form, the primary drug, which is itself not active, but ultimately converted to metabolite which is active. So the primary form is known as prodrug. Now in clinical pharmacology nowadays, prodrugs use is increasing because of some specific reason. Number one is to cover bad odor or bad smell. As for example, ampicillin, its odor taste is not good for the babies, for the infants. So it is converted to tal-ampicillin or becampicillin. This which is well flavored, well accepted, very palatable, and this drug, when it enters into the intestine, converted to ampicillin. Then levodopa is converted to dopamine. Dopamine cannot be given because it cannot cross blood-brain barrier. but its precursor levodopa can cross blood-brain barrier and attains the basal ganglia used in the treatment of Parkinsonism. Now, also the concentration of drug at the site of action can be increased by using prodrug. Also, levodopa is combined with carbidopa. This carbidopa is added because levodopa undergoes peripheral decarboxylation, so the amount enters can be reduced. To prevent that, we can block the peripheral decarboxylation by giving carbidopa. So carbidopa and levodopa combine for use, and they enter the they cross blood-brain barrier, and at the basal ganglia it increases the level of dopamine and used in the treatment of Parkinsonism. Then cyclophosphamide is an anti-cancer drug, but it is a prodrug, and the active form is phosphoramide mustard. Phosphoramide mustard, they destroy the cancer cell. We want that drug anti-cancer drug destroy cancer cell, but leaving intact the good healthy cell. But when phosphoramide we use, then it will destroy all the cell irrespective of cancer or healthy cell. So cyclophosphamide used, which will not destroy the healthy cell, and it will come to the site of tumor where it will be converted to cyclophosphamide, and then it will destroy the cancer cell. For this purpose, prodrugs are used. Now the third example, third results of biotransformation is active drug becomes converted to active metabolite, and examples are codeine converted to morphine, heroin converted to morphine, amitriptyline converted to nortriptyline, then diazepam converted to oxazepam, propranolol converted to hydroxypropranolol. Here primary drug is active as well as their metabolites is also active. In this case, the activity of the primary drug is lengthened because both active and metabolites are active. That's why action is lengthened. Number 4 results is most of the time drug become detoxified, but there are in some situation there are some drugs which drug itself is non-toxic but may be converted to toxic product. As for example, INH converted to acetyl hydrazine, then sulfonamide converted to acetylated sulfonamide, then halothane converted to trifluoroethane, and methoxyfluorine converted to fluoride, paracetamol converted to NABKI. NABKI means N-acetyl benzoquinine imine. Now, INH converted to acetyl hydrazine. This metabolite is hepatotoxic substance, damages liver cell, and also it combines with pyridoxine vitamin B6 and form complex and eliminated from the body. So the vitamin B6 hydroxy level will be decreased, which may lead to peripheral neuropathy during INH therapy. For that reason, in tubercular patient, while treating with these drugs, supplementation of vitamin B6 is necessary. Then acetylated sulfonamide, which is the metabolite product of sulfonamide, this causes kidney toxic effect, renal toxic effect. In the filtrate, they will form crystalluria, and then it will cause proteinuria, then it will cause hematuria, it will cause oliguria and anuria. So these are the toxic form of the sulfonamides. Similarly, halothane, which produces trifluoroethane, which is also causes hepatic damage. Methoxyfluorine, it produces fluoride, which is cellular toxic substance, and paracetamol, which is converted to NABKI, N-acetyl benzoquinine imine. It is a hepatotoxic substance. It damages the hepatic cell unless it is scavenged by methionine or cysteine or glutathione. So these are the results of biotransformation. So objective of biotransformation is to make drug, converts drug to excretable form, and the results of biotransformation are active drug becomes inactive, inactive drug becomes active, active drug maintains activity, and drugs becomes non-toxic, but there are some drugs which non-toxic drugs usually converted to not drugs is detoxicated by the biotransformation system, but in some drugs which become toxic, but the parent drug is non-toxic. So these are the results of biotransformation. Now the processes of biotransformation. Processes are two, these phase 1 and phase 2. Phase 1 or synthetic phenomenon, phase 2 or phase 1 is non-synthetic phenomenon, and phase 2 is synthetic or conjugation. Now the sites of biotransformation, most important site is liver, then kidney, then lungs, then intestine, RBC, skin. So various organs may be involved in biotransformation, but most important organ is liver. Very important organ, primary organ for biotransformation is liver, and the next to that is kidney. So when there is liver disease or when there is kidney disease, then biotransformation will be inhibited and drug excretion will be inhibited. Now the phases of biotransformation, phase 1 and phase 2. Phase 1 also called non-synthetic, and phase 2 is called synthetic. Now among the non-synthetic process of phase 1, it is categorized as oxidation, reduction and hydrolysis. Now in this phenomenon, either there is addition of oxygen or removal of hydrogen, or removal of addition of oxygen or removal of hydrogen, or it may be addition of hydrogen, removal of oxygen, or there is breakdown of drug with in presence of water. So these things are occur here. The parent drug is undergoes breakdown and loses lipid solubility, and when becomes water soluble, some of them drug goes directly to the for excretion. But some drugs will go to phase 2 for further metabolism. And during phase 1, the metabolite remains active, may becomes active, may be retained activity, or it lost activity. Prodrug gains activity, many drug retains activity, and many drug lost its activity. But in phase 2, in conjugation reaction or synthetic, also known as synthetic reaction, here the parent drug becomes here the metabolite becomes highly water soluble, polar, and it is always inactive. So a drug becomes inactive, it may be metabolized by not only phase 1 but also by phase 2. But when a drug becomes active, inactive drug becomes active, it is always by phase 1, because it will not be done by phase 2. Now phase 2 is called conjugation or synthetic reaction. Conjugation in this because it is conjugated with the endogenous substance of the body, like glucuronic acid, like acetic acid, like methionine, like glycine, like glutathione. With this, that's why, and produces new substance, that's why it is called synthetic reaction. So phase 2 or conjugation or synthetic reaction. Now parent drug may directly enter to the phase 2 reaction and undergoes metabolism and becomes highly water soluble, excreted from the body. Parent drug directly enters to phase 2, or parent drug by acting upon phase 1 enters into the phase 2, and then it is ultimately goes to the for excretion. So drug some drug directly excreted from the body without involvement of phase 1 and phase 2. Some drugs, majority of the drugs undergoes phase 1, then phase 2, and some drug directly goes to phase 2, and some drug directly goes to phase 1 and exit from the body. Now there are some enzyme involvement occurs in majority of the cases, but there are few drugs which are not where metabolism does not occur due to involvement of enzymes. And here the drug is broken down due to the changes in pH in the surrounding fluid. As for example, atracuria, which is used as skeletal muscle relaxant. For this metabolism of this drug, no need of kidney, no need of liver. So in liver disease, kidney disease, this drug can be used because this is spontaneously hydrolyzed by the changes in pH of the surrounding fluid, and this is known as Hoffman's clearance. So phase 1 and phase 2, ultimately drug becomes water soluble and drug will be excreted from the body. Now the enzymes involved for the metabolism of drug. These enzymes may be of two types. One is microsomal enzyme, one is non-microsomal enzyme. Non-microsomal enzymes, they may be present in plasma, in cytoplasm, in mitochondria, and they are maybe esterase, amidase, then monoamine oxidase, then xanthine oxidase, then pseudocholinesterase, acetylcholinesterase. These are alcohol dehydrogenase, aldehyde dehydrogenase. These are non-microsomal enzyme. And microsomal enzyme, it is present inside the microsome. Microsomes means when surface endoplasmic reticulum is highly undergoes ultracentrifuged in high speed. At the bottom there is tiny droplets, and at the above supernatant fluids. If we discard supernatant fluid and this tiny droplets is further ultracentrifuged in high speed for several times, then finally tiny droplets at the bottom is deposited, and that is known as microsome. These microsomes are content, they are bag of enzymes or sac of enzyme. This is full of enzymes, and this is very important enzyme for drug metabolism. Now, those drugs which will be metabolized by microsomal enzymes, they must enter into the site. So they must be highly lipid soluble drugs. Only highly lipid soluble drug can enter and will be metabolized by this microsomal enzyme. And also some endogenous substance of the body like bilirubin as well as steroid undergoes metabolism by this process. Now among the phases, phase 1 and phase 2, among oxidation, reduction, hydrolysis and conjugation, the most important reaction occurs is oxidation in phase 1, and most important reaction among the phase 2 occurs is glucuronidation. So all these processes, oxidation, reduction, hydrolysis and glucuronide conjugation, will be divided into microsomal and non-microsomal. So most important process is microsomal oxidation, and in phase 2 microsomal glucuronide, non-microsomal glucuronide conjugation. Now, about there are several factors which can modify biotransformation, like age, sex, race. These are personal factor modifies biotransformation. Similarly, nutritional factor is plays important role to modify biotransformation. Also, environment factor also plays important role. But most important role which modifies biotransformation is enzyme induction and enzyme reduction. We have to discuss these things a bit more detail. Enzyme induction means enzyme production will be increased, and thereby their activity will be increased. So the activity of the drug metabolism will be increased, and their drug action will be decreased. Now, there are some drugs which will induce microsomal enzymes, like rifampicin, like phenobarbital, like carbamazepine. There are some foods, DDT, foods containing hydrocarbon, fast food containing hydrocarbon and preservatives, they also induces microsomal enzyme. As a result of induction of microsomal enzymes, there are several things, there will be several consequences occur, like action of the drug will be terminated, and their increased toxic effect will occur. Now, suppose the action of drug will be terminated. For example, if we give a newly married couple does not want to conceive very recently, and the lady used to consume contraceptives, but unfortunately she is suffering from pulmonary tuberculosis or she has got insomnia, and for that reason she uses rifampicin or phenobarbital respectively, as the situation may be. And this drug will induce microsomal enzyme and will increase the metabolism of the oral contraceptives. So finally a time will come when there will be failure of contraceptives because and she will conceive. So by increasing microsomal enzyme activity, this drug failure of contraceptive therapy occurs. At the same time, if due to insomnia, as a hypnotics, phenobarbital use widely used once upon a time, if this drug is used for chronically, then its metabolism will be increased because it induces its enzyme, microsomal enzyme, which will increase its own metabolism, and ultimately activity of the drug will be decreased. So this will produce gradual diminution of response, and ultimately this is called tolerance. So tolerance is gradual diminution of response due to repeated administration of a drug is called tolerance, and this phenobarbital induced tolerance is pharmacokinetic tolerance. Now also it will induce toxic effect. Say for example paracetamol, its toxic metabolite is NABK, N-acetyl benzoquinine imine, but any inducer drug if used along with it, so there will be increased toxic metabolite NABK, and that will cause damages of the hepatic cell unless otherwise scavenged by the glutathione or methionine or cysteine. So another drug, anticonvulsant drug, if we used which will induce enzyme, they will increase in epileptic patient, they will increase the metabolism of vitamin D, and they may produce osteomalacia. So in this way toxic effect can also be increased. These are the consequences of enzyme induction, and enzyme may be inhibited. There are some drugs which will inhibit enzyme, as for example chloramphenicol, then tolbutamide, then ciprofloxacin, then macrolides, metronidazole, these drugs, monoamine oxidase inhibitor, ACEI, these drugs will inhibit. Then omeprazole inhibits microsomal enzyme. As a result, the second drug activity will be increased if the patient is getting warfarin sodium or tolbutamide or methotrexate. So due to inhibition of the enzyme, this drug free level in the plasma will be increased, its activity will be increased, and its toxic effect will be increased. So in case of warfarin, there will be increased bleeding. In case of tolbutamide, there will be hypoglycemic shock. In case of methotrexate, maybe blood dyscrasia. So in this way, enzyme induction and enzyme inhibition can modify biotransformation. But most important aspect is enzyme inhibition. In clinical pharmacology, enzyme inhibition is more important than enzyme stimulation. And in this way, they will produce drug interaction. So this is in nutshell about biotransformation of drug. So in this chapter, the most important things to be remembered is objective and results of biotransformation, types of biotransformation, factors modifying biotransformation, and enzyme induction and enzyme inhibition. And my next class will be on excretion of drugs. Thank you for your patient hearing. May Allah bless all of you. Assalamu alaikum wa rahmatullahi.